Welcome to our Healthy Byte for AI 101 within the healthcare industry. I'm Amy Mushahwar, a partner here at Alston & Bird, and I'm joined with our senior associate, Kate Hanniford, and we are in the Privacy, Cybersecurity, and Technology Practice Group. We're delighted to talk with you regarding AI today, and to get us kicked off, Kate, what is AI?
That's a great question, Amy. AI is essentially intelligence demonstrated by machines. Think of it as computers doing things that humans normally do. But in order for that to work, you need to train the algorithms and ensure they're functioning as intended. And in order to do that, you need a lot of data. And that, of course, raises a host of privacy and data security questions.
Of course it is. We're training algorithms to think like humans. And, as we're thinking about AI, what are some applications?
There are many different applications of AI, particularly in the healthcare sector. We're seeing an increasing use of them across a range of different health industry participants, beyond simply managing electronic health records, which might be one of the more obvious things you might think of, but also fraud detection and to provide more personalized communications with patients, as well as even automating prior authorizations for providing care or services to patients.
Oh, that's great. And in my personal practice, I've seen some really interesting applications like, better understanding diagnostic data, understanding treatment variability, like what types of dosage treatment may work on some patients versus other patients, reviewing diagnostic imaging, and also language translation and IT management, given that healthcare companies are big IT companies nowadays.
What are some of the governance processes for AI?
Oh, absolutely. Well, we can start with the FTC has released some very helpful guidance on the governance processes for AI, which, really are not rocket science. They are transparency, concept that we know in our privacy study, explainability, ethical use, and proper oversight. We have these terms because we're really trying to control for bias in the algorithms, the training data that is used for those algorithms, and also the outputted data. We want to make sure that we can explain the data throughout the data lifecycle, and also that the outputted data that we ultimately have is valid.
Those are such great points and so incredibly important once you consider all the different uses for AI in healthcare, and particularly at the intersection of patient care and patient data. Can you talk to us a little bit about some of the practical use case problems or pain points that we see?
Sure. I think most importantly, the pain point is if we have bias, we might have unfair discrimination in healthcare outcomes and healthcare treatment, particularly for at-risk populations, minorities, and women. So we want to understand bias not only in the algorithms and in the training data, because we want to make sure that the data insights that we are making and using with AI are actually valid in application and are going to produce the outcomes that we hope that they produce. But I do think, in thinking about potential negative outcomes, there's also a lot of positive here, and that AI gives us unique and wonderful opportunities to distill data sets that, previously we could not compute. So even though we have, a large amount of potential bias, a large amount of potential negative outcomes, we also have far significant abilities to process data, to analyze data, and to understand patient treatment that we never had an opportunity to understand before. So quite promising.
Indeed. Well, thank you so much.
Oh, well, thank you. And thank you all for listening to our Healthy Bytes 101 for its application to artificial intelligence within the healthcare industry. Both Kate and I are delighted to answer any questions offline, and just thank you for your time today.